Right now, your feet may be trying to tell you something. Something your last blood test completely missed. 115 million Americans have blood sugar that is already too high. 8 out of 10 of them have no idea. Not because they skipped their checkup. Not because they ignored their doctor. Because the warning signs showed up somewhere their doctor never looked. Their feet. The answer was in their feet the whole time. Take Carol. She was 64, retired school principal from Tennessee, active, sharp, no family history of diabetes. For about a year, her feet felt strange at night, like pins and needles. She thought she was sleeping on them wrong. Then the tingling started happening during the day, while she was just sitting, reading, watching television. She mentioned it to her doctor during a routine visit. He checked her reflexes, said everything looked fine, told her it was probably age. 6 months later, a different doctor ordered a simple blood test. A1C. Carol's number came back at 6.1. She had prediabetes. Had it for years. Her feet had been telling her for a year. Today, I am going to show you 8 specific signs your feet send before a blood sugar problem is ever caught on a standard test. Sign number 7 surprises almost everyone. And at the end, I will show you 3 simple things that can actually reverse early blood sugar damage. Not manage it, reverse it. The research is clear on this. I am Dr. Michael Hayes. Everything here is for education only. I am not your personal doctor. Always work with your own physician. If you are having a medical emergency right now, call 911. But this information, I believe every adult over 50 deserves to hear it. Because the earlier you catch this, the more completely it can be reversed. Before the 8 signs, you need to understand one thing. Because once you understand this, the signs make perfect sense. Your blood vessels are like garden hoses. When blood sugar stays high for months or years, even slightly high, it is like running acid through those hoses. The inner walls get damaged. They get stiff. They get narrow. Blood flow slows down. Now here is the critical part. Your feet are the furthest point from your heart. They get their blood supply last. So when circulation starts to drop, your feet feel it first. At the same time, high blood sugar damages the tiny nerves in your feet. These nerves are very thin, very delicate. They are the first nerves to be affected. And here is what makes this so important. These foot symptoms can appear 3 to 5 years before blood sugar is high enough to show up on a standard fasting glucose test. 3 to 5 years of warning time that your doctor may have missed, that your feet were already sending. Here are the 8. Sign number 1, tingling in the feet or toes, especially at night. You lie down, you try to sleep, and your feet start to buzz or prick, or feel like they are waking up even though you never fell asleep on them. Most people blame their mattress, their pillow, their sleeping position. But this specific tingling, starting in the toes and moving upward, has a name. Doctors call it stocking and glove neuropathy. Why does it happen at night? During the day, you are moving. Your circulation is active. It masks the damage. At nighttime, when you are still, the nerve damage has nowhere to hide. If you have had unexplained foot tingling for more than 2 weeks, especially at night, that alone is worth a conversation with your doctor. Ask specifically for a hemoglobin A1C test, not just a fasting glucose. Sign number 2, a burning sensation in the feet. not heat from the outside. Heat from the inside, like your feet are on fire, but when you touch them, they feel normal, or even cold. This happens because damaged nerves send confused signals. The nerve is firing, but it is misfiring. It tells the brain there is heat. There is no heat. The nerve is just broken. The key distinguishing feature: the burning is worse at rest. It improves when you walk, because walking restores some circulation temporarily. This is the opposite of most other types of foot pain. Sign number 3, numbness. Patches of your foot that feel nothing or less than they used to. You step on something small and you do not feel it. Your shoes feel looser than they are. This is particularly dangerous because numbness hides injury. A small cut, a blister, a wound that does not hurt, and therefore does not get treated. A simple self-test you can do right now. Take a pencil eraser. Press gently on different spots on the bottom of your foot. Can you feel it equally everywhere? Or are some spots less sensitive? Uneven sensation PON, especially in the ball of the foot or the toes, can often be a sign to watch out for. It is worth telling your doctor about at your next appointment, this week if you can. Sign number 4, feet that are always cold. Even in a warm room, even under blankets, your partner's feet are warm. Yours are like ice. Every single night. Cold feet from blood sugar problems feel different from regular cold feet. Regular cold feet warm up within a few minutes once you are inside or under covers. Blood sugar cold feet stay cold. The warmth does not come back. The reason: damaged blood vessels are no longer efficiently delivering warm blood to the toes. If your feet are consistently cold and you are over 50, ask your doctor to check your peripheral circulation as well as your blood sugar. Sign number 5, because it is the one that can turn into a serious medical situation fastest. Wounds on your feet that heal slowly. A small cut. A blister from new shoes. Any healthy adult, these close within a week, maybe 2. With elevated blood sugar, the healing process breaks down on 3 levels. High glucose damages the white blood cells that fight infection. Reduced circulation means fewer nutrients reach the wound. Nerve damage means you may not feel the wound worsening. Any foot wound that has not shown clear improvement in 10 to 14 days in an adult over 50 is worth a doctor visit. Do not wait. We are halfway through, and I want to tell you something. The next 3 signs most people have never heard of. Signs 6 and 7 especially. Most doctors do not ask about them. Sign number 6, changes in the skin on your feet and lower legs. Skin that becomes unusually dry, that cracks, especially around the heel even when you use moisturizer. Skin that becomes shiny. Or hairless. Wait, hairless? Yes. When circulation drops, hair follicles do not get enough blood to grow. Hair on the lower leg and top of the foot can thin or disappear entirely. Many people assume this is just aging. Sometimes it is. But when it appears alongside other signs on this list, it is a pattern worth investigating. Sign number 7, the one most people never connect to blood sugar. Leg cramps at night, specifically in the calf or the foot, coming on suddenly, waking you up, painful enough that you have to get up and walk it off. Most people know that dehydration causes cramps. Most people know magnesium deficiency causes cramps. But very few people know that elevated blood sugar is also a major driver of nighttime leg cramps. Here is the mechanism. High blood sugar pulls fluid out of the body through the kidneys, causing dehydration at the cellular level even when you are drinking plenty of water. This cellular dehydration depletes electrolytes in the muscle, including magnesium and potassium. The muscle cramps. This is why people with uncontrolled blood sugar report cramps. Even when they drink water and take magnesium, the root cause has not been addressed. If you have regular nighttime leg cramps and you are over 50 calm, please ask your doctor for a hemoglobin A1C test. The A1C shows your average blood sugar over 3 months. It catches what a single reading misses. Sign number 8. And this one represents the most advanced stage of blood sugar damage in the feet. Toes that are curling more than they used to. The arch collapsing. The foot looking slightly swollen or misshapen. You've demonstrated significant progress in your recovery without any injury. Excellent work. If you have noticed your shoes fitting differently or new calluses in unusual places, cough, these are worth mentioning to a podiatrist or your doctor. Now, I want to talk about what is actually causing the blood sugar to be elevated in the first place, because most people focus on the wrong thing. Let me show you what you should be looking for instead. The real driver of prediabetes is insulin resistance. Your cells have stopped listening to insulin as well as they used to. Insulin resistance is driven by 3 things that are all addressable. Excess body fat, GMOM, particularly around the abdomen. Physical inactivity. Muscle is the body's primary site of glucose uptake. Chronic poor sleep. Even 1 week of poor sleep increases insulin resistance significantly. These 3 things, body fat, physical activity, and sleep, are the levers. They are not easy levers, but they are real ones. And one more thing, some acid reflux medications, like omeprazole, can deplete vitamin B12. And B12 deficiency causes the exact same tingling and numbness in your feet. If you take a PPI daily, ask your doctor to check your B12. Now, the part that actually matters most. What to do about this today? Step 1. Look at your feet right now. Tonight, both feet. Look for anything different from what you are used to. Any tingling, any unusual dryness. Step 2. At your next doctor visit, palm on, request a hemoglobin A1C test, not just a fasting glucose. Step 3. Add a 10-minute walk after each meal. This is not about exercise. It is about timing. Walking after eating uses the muscles at the exact moment blood sugar is rising, pulling glucose out of the blood before it causes damage. Step 4. Reduce refined carbohydrates before bed. Your blood sugar rises naturally in the early morning. Step 5. If you have any of these 8 signs, tell your doctor specifically about your feet. I have noticed changes in sensation or temperature in my feet. I would like them checked. Now, Tal, the part I promised you at the beginning. 3 things that can actually reverse early blood sugar damage. The CDC's own diabetes prevention program, a landmark study of over 3,000 adults, found that modest lifestyle changes reduce the risk of developing type 2 diabetes by 58%. From lifestyle changes alone, not medication, not surgery, walking, eating habits, sleep. Your A1C number updates every 3 months. What you do starting today shows up in your next reading. Let me bring Carol back. Now we can proceed. 6 months after her diagnosis, she started walking 10 minutes after every meal. She stopped eating after 8 at night. She went to bed 30 minutes earlier. 6 months later, her A1C was 5.8. Her foot tingling had reduced by more than half. Her doctor said, "Carol, whatever you are doing, keep doing it." She told me something I will never forget. She said, "I never thought my feet would save my life, but I think they did." That is why this video exists. So the next person in Carol's situation knows what to look at, knows what to ask for, knows that there is a window and that it is still open. Here is what I want you to do right now. Before you click away, think of one person in your life, are tense, over 50, hands, who complains about their feet. Tingling, cold, cramps at night. Maybe they have mentioned it and brushed it off. Send them this video. You do not need to say anything alarming. Just, I learned something I think is worth knowing. Thought of you. I will wait. That message could be the reason someone asks for an A1C test they never knew to ask for. If this video gave you something useful, calm, please hit like. And if you want more medically accurate health information made for adults over 50, subscribe to this channel. I am Dr. Michael Hayes. I will see you in the next one.